All right, great. Well, hello there, everyone, and welcome to our 21st Century Caregiver Workforce Issues Subgroup meeting. I hope for all of you, your February has been off to a great start. It's hard to believe that it's almost mid-February already. Time is just flying by. But we certainly appreciate you all being with us this morning. So I guess let's start with a review or I guess consideration, a motion for our previous meeting minutes. Our meeting was held last month on January 4th. You all should have received those minutes. Any questions or any updates or edits that need to be made to those minutes? Otherwise, if I could have a motion to approve those minutes, that would be great.
Motion to approve.
Great, thanks, Jackie. And second?
I'll second, or Wendell can second.
Great, thank you. And I guess all in favor, raise your hand. Awesome. All right, thank you so much. Well, then let's just dive in. So we really don't have any presentations on the agenda today. We really were just hoping to use our time together to kind of, talk for a robust conversation amongst this group to come up with those 2 to 3, really hone in on those 2 to 3 specific recommendations that we would like to present to the larger Aging in Place working group at our next meeting, which I think may be later this month. But really kind of, again, just really hone in on those 2 to 3 things that we want to focus on. And I figured what might be a good place for us to start in this conversation and really to tee it up is if I could provide you all with a recap of what we have talked about in the previous meeting. So, obviously we know that there's a growing demand for direct care, but here in our state of Delaware, but not enough workers to meet that demand. We know that direct care workers care for and support some of our state's most vulnerable. However, the workforce itself is also vulnerable to low wages, harsh working conditions, and economic insecurity. So obviously, our state more needs to be done here in the state of Delaware to address the need for a prepared, well-trained, and empowered direct care workforce now. So I don't think it can be said enough that this issue is with us now. And so we really can't wait. We have to address it now, as well as in the future, especially as we know in our state of Delaware, we have a large and growing aging population. And so this issue is only going to continue to be exacerbated into the future, given that large and growing aging population. So, there's things that we could do. Some of the things that we've discussed as far as addressing this issue is around recruitment, retention, and advancement of the direct care workforce pipeline. Things to make the field more attractive, such as training, career pathways, mentoring, strategies that encourage retention and career advancement, and really responding to the needs of our growing aging population, and ensuring that our direct care workforce is supporting the health and well-being of those who need and rely on direct care services. Again, the whole point of the Aging in Place working group is how can we help Delawareans to be able to age in place in their communities of choice. And a workforce is a big component of that. Again, supporting the health and well-being of those who need those direct care services. And then, of course, we've talked also about the unpaid caregiver workforce, or our family caregivers, and the need to support family caregivers as well. Certainly, they play an integral role in all of this, and it's imperative that we ensure that they have the necessary services, resources, and supports that they need. So as I was thinking about potential recommendations that we might want to put forward, again, around these issues of supporting the caregivers, recruitment, retention, career advancement, ensuring that we're making this field attractive for people to go into the field, but also stay in the field. I think about a couple different avenues that we might want to explore. So, certainly legislative recommendations. I know we've, have already talked about the potential for caregiver tax credits. Senator Montsevinos does have a bill out there already around caregiver tax credits. That it could be establishing tax credits for qualified caregiver expenses. and or making family caregivers eligible to receive payments for some of their caregiver hours. For example, when I think about budgetary recommendations, certainly it could be around funding for a marketing communication strategy to raise awareness of resources, services that are out there for caregivers. Certainly we can look at, and I know we've talked about the wage situation of our direct care workforce. So looking at expanding funding to ensure direct care workers are paid competitive wages, increasing funding for respite care. And then there's also a route where we could, look at policy or program recommendations as well. And I know Brian DeSapit is doing some really great things, innovative things to improve and enhance the resources and services for caregivers. And so, that's certainly something that, we might want to help promote and put out there so that the community is aware of what's available. So those again, and there's other, I think, innovative things that we can do around caregiver education to reduce caregiver stress, skill building for our caregivers. So those are some of the things that I've been thinking about. But again, so I really just want to tee it up and certainly look to all of you. Your insights and perspectives and experiences is incredibly valuable input into all of this. So I guess with that, I would love to open it up to the group for your thoughts or ideas, again, and really honing in on those 2 to 3 recommendations that we want to put forth to the larger working group. And one thing that Senator Bernini and I have talked about is, and certainly we don't have to get into the specifics today. We can talk more broadly and high level. But when we do get down to the specifics of the specific recommendations that we want to put forward, we do think it's important that we get really specific with those and detailed, as opposed to keeping it broader. But I think for the purposes of our conversation today as a group, we could keep it more broader. Again, the 2 to 3 things or areas that we want to focus on. So I'd love your thoughts.
I'm just going to pipe in. Nancy Bernali, I'm not sure how many of you know Nancy Bernali. She's the other Verna Hensley on the there we go. She's changing it over. That's cool. So she's the director of our community outreach program here at Easter Seals. And she was and is actually coordinating the Respite Coalition that Easter Seals was spearheading. And she was going to make a presentation last meeting on the Respite Coalition, but I had to pinch hit for her at the last minute because she had an emergency come up. But anyway, I invited her to be a part of this conversation. I know, Katie, you've worked a lot with Nancy in the past as well, but she has especially a tremendous focus on respite and family caregivers and their needs. So I thought it would be helpful to have her be a part of the conversation too.
Absolutely.
Katie, can I take just a second to mention this? This seems like a good group to say this to. Today, very excited that we posted the position for the caregiver and dementia person that we're hiring.
Oh, yay! That's awesome to hear.
So it hit the state website today. So if anyone thinks of anybody that might be interested, it's posted for 2 weeks. So there's plenty of time to get a proper candidate. So please take a look and pass it along to whomever. Thank you.
Oh, that is fantastic news. That really just makes my morning, Brian. I'm so excited to hear that. I think that position is going to be just invaluable to our efforts in Delaware statewide.
Can you just tell me a little bit more? I'm not familiar with that. Can you tell me a little bit about what that responsibility is going to be?
I wouldn't be the proper person to do it. I'm sorry. I'm actually going to go in and grab the link and send it to you now. I know that as we look to expand for caregivers and, spend and appropriate more money towards them, it'll be in this role to do that as we see fit, as well as dementia. Any dementia grants that we get that Katie's well aware of, they're going to be the ones that spearhead it, because as we get more things added to what the SAPID does, we just want to make sure that there are point people who are able to handle it. And this will be that person.
Yeah, I think that's a great way to describe it. It is really awesome. It's really exciting. And Will, I'm not sure if you're able to do this on your end, but Senator Bonini said that he is on, but he's on via the phone. His internet is down. Are you able to bring him into the meeting
Yeah, yes, I am. Actually, Bob Byrd was also calling in. I was just trying to confirm if that was him, but it is Senator Bernini, so I'll do that now.
Oh, great. Thanks, Will. Oh, I think you're in, Senator Bernini. I see a number in here. It looks like your number. I think he's joined us. Let me just, well, as he's figuring out how to unmute, I think that's incredibly exciting, Brian. I think it's really huge for the state of Delaware. And my understanding as well, which I think is going to be, it's something that's needed here in our state because oftentimes services for the population of people with dementia and for caregivers too, among state agencies can be siloed. My hope is, I think, and what I envision with this position is that it's going to help coordinate those services or what's happening across the various divisions of DHSS related to dementia and caregivers. And I also understand from Cindy Mercer that this position will be submitting an annual report to the governor and Secretary McGarrick on the services that are being provided by the various divisions of DHSS related to dementia and caregiving as a way to elevate, what's already happening out there, but again, also ensure consistency and coordination across divisions. And it looks like Senator Bernini is unmuted.
Oh, I'm sorry to interrupt, and you guys got the varsity and Katie anyway, so but I apologize, folks. My internet went out literally 2 minutes before 10, and there's currently a little trickle of Xfinity trucks at the end of our driveway, so that's probably a good sign. But anyway, just I think I got a chance to listen to the last few minutes. That is exciting, that new position, and my only input, and Katie, please thank you for doing this. Fantastic. Is just to reiterate, let's try to get down to literally 2 or 3 very specific recommendations, even if they're not as comprehensive as we would like them to be. The more specific, the better chance we have of accomplishing them. But I'll shut up and listen, and I apologize, folks, for the delay.
No worries, Senator Bernini. We're glad you're able to make it on. Thank you.
I guess I can speak at least on the part of the professional side of what we're looking at. And obviously the number one thing for us is wages. I mean, we're just bleeding caregivers to Target, to McDonald's. And it's, you would think at one point we would see it leveling off, and it's not. So, I mean, that is just an incredible thing that if we don't stop it, I can't even imagine where it's going to go. So on the professional side, I would say that's our number one ask.
Yeah, okay. And I apologize, folks, I can't see who's talking or not. So if I interrupt anybody, please just interrupt me right back. And again, I apologize. And what do you think should be sort of some of the specific proposals? Is that budgetary, saying, hey, whatever the state's covering, we need to obviously increase that, and we're going to talk about the respite number here in a little bit as well? Or is that trying to help put together programs to advertise and some of the things we talked about, not just advertise, but to sort of long-term help folks choose this career? I mean, what do you think should be the, and again, we're still obviously hammering this all out, but what would you think is a specific ask? And if that's unfair to ask this at this point, please tell me. But
at least on my vision that I can see is just for the immediate thing would obviously be funding. I mean, that's going to be the quickest thing to put into place, so we can then at that point maybe start looking at career pathing and opportunities like that. I think we just have to prioritize what's going to slow this down, and then how do we expand on it to be able to control it.
Jackie, and I'm correct that you're talking about, I'm Colin. Hi, it's Verna. Sorry, I didn't mean to interrupt you.
Hey, Verna, and I'm so sorry, folks. I would love to see everybody, but
no problem. Jackie, you're talking about the reimbursement issue, right? Yeah. So I think Katie, you did a really great job sort of summarizing in the very beginning. Colin, I'm not sure that you heard all of kind of Katie's summary.
No, unfortunately, I didn't.
No, but she talked about of the 3, what I took away as sort of 3 focus areas. The workforce development is certainly key to that. So Colin, what we're talking about sort of to stop the hemorrhaging, I think, is a good way to put it, right? Because we're all
Yeah.
whether it's whatever sector it is, that, you know, whether it's the intellectual disabilities, whether it's the long-term care, whether it's the nursing home, the support, you know, that's where we're hemorrhaging the workforce. So it's really taking a look at the reimbursement rates that the providers are being paid, which directly impact the wages that their staff can be paid in terms of the professional workforce. Right, Jackie?
Exactly.
That's what-
That's
yeah.
exactly it.
So, you know, that's sort of where, like I said, the hemorrhaging occurs. And of course, I feel like ultimately the professional workforce that support works feeds also, you know, it spills into kind of that respite relief too, because part of the problem even if you have respite dollars as a caregiver, and Nancy can talk to this, even when you have respite dollars that you can access to pay someone to come in and give you a break, you can't find those people, right? So if you're able to then, get a support worker who wants to also do some work on the side or privately or whatever, that at least you've got people who are trained professionally that can also still fill some of that respite function. But yeah, I would say it really means taking a hard look, Colin, at the reimbursement rates. Honestly, it's across the board. It's really across the board in terms of what the state is contracting to do this work. Then they have to be brought up to a livable wage for the workers.
Okay, and oh, I'm sorry. Go ahead.
No, that's at least that's
and what
a key piece, I would say. I don't know if it's
no. I think we. No, but it's obviously a critical piece, no question. But we've talked about it before. Do we? And I apologize, I don't have the numbers in front of me. What does that look like? I mean, I guess sort of, and these are unfair questions. I get it, but I'm happy to sit down with a budget analyst and offline or whatever you think is appropriate. But what does that look like? And my experience has been the smart way to do these things is to ramp up so that the sticker shock isn't as tough on my colleagues and the governor. But if that's not the answer because we're at a critical need, tell me. But I guess the question is sort of with putting the plan together. What do we think those numbers might initially look like? And I'm not asking you to say. We'll crunch the numbers, sit down with the controller general and crunch what the actual full-blown numbers are. But what do you think that looks like in the short term? And is this a sort of a graduated thing where we get there, or is it we've been so behind that it's going to take a big lump just to help?
Well, that's the challenge because unfortunately the reimbursement rates have been allowed to languish, and I can't even begin to imagine what the number is. If you're looking at across the board, the services between long-term care and the intellectual disabilities care, it's a big number. I'm not going to kid you. Now, One of the things though, and you may remember this, Colin, back when Quinn Johnson was chair of JFC, and Mike Jackson was the budget director, they actually put into place it's called I can't remember what the final name was, but it's basically a proposal whereby the human services reimbursements rates would be routinely reviewed and updated by DHSS. It's something like the roadmap, reimbursement rate roadmap. And that proposal was put together. It's housed within DHSS, and it's charged with periodically and systematically looking at those reimbursement rates. Because honestly, Quinn and Mike Jackson felt like that's really the way to attack this on the longer term process, right? You can't, if you want to do it fairly, these rates need to be reviewed and regularly, incrementally reviewed and incrementally raised. And then the pandemic hit. So I don't know how much work has actually been done on that. I think that's a long-term solution to be, I mean, it makes sense, right? You look at where the most urgent need, you look at where the most urgent need is, and but you can't ignore everybody and just throw money at one or the other. You know what I mean?
Yeah, no, I agree wholeheartedly. Do we know if that process is actually happening yet, or I can find out?
I know that it had begun. I know that they were working on, as an example, they were looking at the reimbursement rates that behavioral health and substance abuse providers were receiving, because that's obviously Delaware's number 2 in overdose deaths in the country. And so that was elevated to be sort of a priority, which would make sense. I think that report just got completed. I don't know what's kind of next in line. That's where I'm not certain. And again, I know because of the pandemic, DHS has been slammed. It's not like, they've had the bandwidth to necessarily go forward with that. But that would be a DHSS question, I think.
Yeah, so that report is partially done. Yeah, it's out there, and I'd have to read it. It's obviously very lengthy, and I haven't read through it yet. But it's made to try to be equitable, across the board, which we keep talking about. And the senator asked what I guess feels like a loaded question, but it's really not. Like, what's the total cost to get this thing up and running to the proper level, and then what does it cost to continue it for the foreseeable future, which is the group that you talked about. I want to add a piece because I don't think I did it in the last meeting, and I'm sorry if I'm being redundant, but I think that it helps contextually for the conversation. So FMAP, if you're not familiar, the Medicaid assistance percentage, we got a 10% bump, and I don't want to act like I know what I'm talking about with Medicaid, but I'll tell you what I do know. We got a 10% bump for this year, and part of what Mercer's doing, that's the group that works with Medicaid, is they are offering retention bonuses and hiring bonuses of $1,000 for each of those sections. And they've been doing a lot of work in figuring out exactly how many people, like Colin said, how many people does that include? I think there may be some work there that's been done by them, but that only covers through the MCOs, through DSAPID, through DVI, and a couple other divisions. I don't think it covers everybody. So I did work on how many home health aides and CNAs and LPNs that we had working, and I was asked if we were to give them this number of 18.4%, and I don't know where that number came from, who decided on that, how much would it cost to increase just the DSAPID employees for contracted employees for just 1 year? And it's about $840,000. And we are the smallest group out of all the ones that we're mentioning here. I mean, the MCOs cover far, far, far more many people than we do. So, Senator, I think to answer your question, the work is being looked at. I think that there is a body out there that is looking at the CNAs and the HHAs and that group to get them this funding. I think some legwork has been done, but I don't think any of us has an idea of what that number looks like yet.
Okay. Well, that makes sense, and it's like we're ramping up. Okay. Well, if someone could connect me with, or if I can help, put that together, that would be great. And also sort of I understand we don't want to be inequitable, but what are the priorities, right? And like you said, the behavior stuff, obviously high priority for that. But what has anybody made sort of, hey, these are the first priorities we need to get up to funding, and I'm interested to know what that is as well.
I mean, honestly, it's it's often those that are making the most noise. I mean, that's why we have to make noise, right? That's why we have to make noise. I mean, I will tell you, like, we really made a lot of noise for our intellectual disabilities, for the DDDS folks, and the state reimbursement was only reimbursing $9 an hour for our direct support professionals. And now we're up to $12 an hour. And thank God we are, because we are still having a crisis. I mean, the staffing crisis is, we just did a survey amongst our providers, and a third of our providers in the state are having like 30 to 50% staff vacancies. So just think about that. And this is not necessarily a easy population to necessarily provide for. And that's just one sector, right? So thank God, we got, but what we have to do is raise that same awareness and that need for those home health aides. It's the same kind of issue. And oftentimes it's the same workforce. Nancy, I'm sorry, you had your hand raised too. I apologize.
Yeah.
That's okay. I sort of took it down because I was thinking more on the kids side. But when you're talking about the workforce, one of the things that we're hearing from parents a lot is, are there programs where we can get paid to be the caregiver? So sort of like the personal attendance services program for adults, if there was something similar on the kids side that could potentially, I know there's a shortage right now. Lots of families are not able to get the supports they need through direct support care, nursing, and other supports. And if they were able to, if they could be paid to be their child's caregiver, that maybe could free up some workforce, but also allow those parents to be contributing, making an income because they're not able to work. So I know this isn't aging in place, but I thought when you were talking about Medicaid and workforce, I would just throw that piece in.
I want to try to answer the senator's question. Where do we prioritize? And to Verna's point, I think we got to plug the hole. People are leaving on a daily basis. So the retention of who we already have would be the first priority. And I don't want to speak for the providers. The only providing we do, is through the long-term care facility. And we have the same problem that everyone else has, that people simply leave. And we don't have an open door where people are flowing through it, and neither do any of you, not at the current reimbursement rates. So my first ask would be, how do we hold on to the people that we have so we can at minimum keep the ship afloat? And then I would secondarily work on how do we make this a more appealing career path with education, training, that sort of thing.
Yeah. Okay. And I think that makes perfect sense. And if folks could sort of think about, exactly what that means, that's, and eventually we got to get down to, bonuses or increased salaries or, incentives or whatever that looks like. But yeah. Okay. That I agree. Obviously the money is the critical piece, and we got to find a way to do that. And as Verna said, the good news about Delaware is if you get enough, you just kick up enough dust and you really focus on it, and you come up with a not crazy solution. So you can get things to move. But okay, that's very helpful to me. And Katie, I'm sorry I came in and interrupted and I can't see what's going on, so please forgive me.
Oh, this has been a great conversation. Really good questions, Senator Bonini. And I'm wondering too.
Well, and I'd love to get, and just to be the sort of the level of granularity I'm talking about, I would love to be to the point where, hey, the respite care needs to be X $100 more, right? A number. And by the way, and here's what we need to do for our current caregivers. And literally get down to that level of, because again, my take is the more granular and very specific, even if they're small steps we get, the better chance of achieving.
This is Big Mouth Verna again. What the level should be is the funds. Really, like the services should be reimbursed for the cost that it provide for what it costs. Right? You shouldn't be able to contract with a contractor and pay less than what the service is costing. That's kind of the bottom line on it. And then you need a system which then objectively reviews what that cost should be, right? So that's where your reimbursement review period, that ongoing reimbursement rate review takes place. But the bottom line is the state should really pay the full costs of care and not expect, the contractors to somehow, whether it's, controlling not offering the benefits they really would like to offer to their workers, or whether it's cutting on that middle management supervisory role. You squinch there because you got to pay more down the track to your direct support staff. Those all are really important pieces of quality care. Having those layers, those well-trained managers, to be in supervising positions, that's important. Right now you've got managers and some senior leaders in these organizations that are actually working the floor and doing direct support because they cannot fill the roles. So anyway.
Yeah. And I'm curious.
That's obviously the goal, but my sort of take on that is, let's work to get there, but what's the proposal for this year, right? And what's the proposal for next year? Because my guess is that number is not going to work in 1 year. I don't know that.
Absolutely. No, I think you're right. And I think Brian's point about let's retain who we have is a really good one.
Yeah. And let's think about what that looks like, whether that's because the one other piece of this that's different this year than not is it's at this point it's 3-time cash, but basically 1-time cash, right? It's happened 3 times. But there is 1-time cash to do some things, right? And that of course leads to sort of retention bonuses and those kind of discussions versus building it into the base. But let's think about what that very specifically looks like. So, and I apologize, Katie, I'm talking too much.
No, it's just
per usual. I'm talking too much. So,
so can we put it back on the providers, anyone providing services in the state with this type of employee, to tell us what it would cost to be competitive and give them the correct rate that they deserve. So I know what it costs to run personal care in the state, or what we pay it out. I know exactly what the average is, but that's just the SAP. But again, a very small group. I don't know what the MCOs are paying. But if Verna and Easter Seals or whomever, I know Bob's on here, comes back and say, okay, you're giving me $30 an hour to do personal care. I need $36 an hour. What's that total allotment cost across the board? Because a company like Easter Seals could say that we get reimbursed from all these different funding streams. I have this many employees, it's this much money. I can't tell you that. The SAPID can't tell you, and the MCO uniquely can't tell you because they're only one source. You have to go to the provider. You have to hear from them. What do you need to make it work? So I think that's where we need to start at.
Hey, Brian, this is Jackie, and I think there's data to support it, but roughly an estimate, and this has been done through the providers across the board, typically we pay 45% more than what minimum wage is. So that might give you a little bit of a baseline to kind of understand what we're paying out. And we're well below that now. It's really, the impact. So I can get you started with that number. And I can look and see if I can find some more data that I'm able to share with us on this call on the next meeting. I actually put out an email now to see if I can get you some more numbers, but that's a starting point for us.
Does 45% above minimum wage work for you though? Or is that what's failing right now?
That's where it's been in the past. I think we probably need to reevaluate it just because of where the costs are now, whether it's going to be post-COVID or whatever the situation. So that's why I want to get more concrete. That was the number we did a while ago. And to see if that, obviously we go in for the ask, we want to make sure it's accurate. We don't want to undersell if that's not going to support our needs.
We don't want that cyclical effect. Like somebody said in one of these meetings, and I'm sorry, they're all muddled together right now, that it was a very high percentage of people who are performing these services turn around and are on some type of state benefit service as well, because they don't make enough money to live independently on their own without that source. So I'm feeling a little conflicted in that I kind of work for the state, and yet I'm going to advocate for this group to ask for what's actually needed and don't undersell it, because you're just going to catch yourselves behind the 8 ball again. You need to get in front of it. So I wouldn't want us to do just enough to get those people where they need to have the SNAP program, even though they're working a full-time job. That's just, I don't know what it is, Peter and Paul and all that. I don't know what the saying is, but yeah, that's all we would be doing. We want people to be self-sufficient and not need state services. So let's get us to that point.
And I'll just pipe up. I think what the state actually in this reimbursement rate process review that DHSS is supposed to be doing, and I'm not saying they're not doing it. I'm just saying it, again, with the pandemic, I don't know how much attention it's gotten. They actually are going out to providers, Brian, and they're surveying to gather, I think this is the base. This is how it was with our intellectual disabilities survey anyway, in our report. They went out and they surveyed all the providers to gather that information. And then that was basically how they calculated kind of what they felt, what the reimbursement rate for full funding should be. So I think you're exactly on the right track, Brian. You do have to go back to see, what you basically have to look at what your data is or what your providers are what they say it would cost. And then, obviously the DHSS will look at what's reasonable of that. And, you want the providers also to be wise in how they're managing and you basically want, you don't want failing providers either. So they have to also have have good business management.
Great. And Becky, are you on the call? If you could please remind me to follow up with DHSS so we can sort of figure out where that process is. That'd be great. Okay. So the money is. Go ahead. I'm sorry.
No, I was going to say I don't want to. I think not to move us
no, we're
off.
not going to.
I don't want to lose focus on. I don't want to lose focus on the caregiver support. That's I think another critical part of really the recommendations we want to put forward too. I want to the professional workforce is obviously critical, but I also, the support for the private caregiver I think is also something that Katie you mentioned in the beginning, and I know Wendell you've talked about. So I don't want this to totally be focused on the professional workforce.
Mm-hmm.
Oh yeah, no, absolutely. But the money side is clearly a critical piece. So, but since you brought that up, why don't we talk about what do you think some of the recommendations are for the private caregiver? Well, actually, before we leave the professional side, there was a discussion I think in our last meeting, the meeting before, about it came up very briefly, but I thought it was something we might be able to make some concrete progress on, about allowing for more flexibility in schedules for the employers to allow to book employees in a more efficient manner, and that some of the rules weren't allowing them to do that. And if some of the providers could pitch in, and if I misheard that, please tell me. And if I didn't mishear that, what can we possibly do to help with that? And if I imagined that, please tell me. I don't think I did, but you never know. But we had talked about, block scheduling could be helpful, and cutting travel time and those kind of things. And it sounded like it was a regulatory issue. If any of the providers wanted to chip in on that, or if not, maybe follow up later.
I do remember that coming up, but I don't remember who brought it up, to be honest with you.
I'll tell you what I can remember, and not being the provider here, my understanding was that we essentially are plugging in, I want to get it the right way. We should tell the person getting the service the times that a person is available to work and plug them in that way rather than the other way, and having the participant tell us when they want someone to show up. I need someone at my house between 8 and 10 a.m. to perform personal care service. Well, it's tough to fill that need because everybody wants 8 to 10. So instead, you go back to that participant and you say, we don't have anyone from 8 to 10, but you happen to like to work with Joel. well, Joel has availability between 3 and 5 on Thursdays. Does that work for you? And then they say, oh, yeah, you know what? Okay, fine. Plug it in that way. And it's more efficient that way from the provider side so that you get the full use out of the employee. That's what I took from it, but that's all I remember, Senator Bernini.
Okay. And I guess the question is, and thank you, but I guess the question is there some rulemaking or regulatory or just in practice way that we can help make that more efficient? And if the providers need us to look into changing those things to add efficiency, would love to hear that, because those are also the kind of things that, you know, we can fix, we should try. So
I think that this is Jackie. I think that would be, I mean, we try to do that now some because we're struggling to say these blocks of time, but I guess the biggest obstacle we would have is that would have to be consistent across the board, because then it would get an imbalance of services if everybody doesn't understand this is what you can offer, you know, just for, you know, you don't want this to be a competitive fight. You want everybody to provide services equally. And I don't even know how we could start to do that, but I mean, that would certainly help, you know, if we could go ahead and just offer blocks of time. And, you know, if you're going to be a recipient of these funding, that, you know, you would have to agree as long as it's in a reasonable amount of time.
Right. Okay. Well, let's talk about that further at some point, because if I remember the comments, it was also about much easier on the employee because of travel time and there's gaps and all that kind of stuff, but being able to schedule folks in a much more efficient manner was not just, you know, for the employer's help, but also is going to be much easier on the employee. And of course, we'd have to handle it very, you know.
Yeah, that's definitely.
I'm sorry, Jack.
Yeah, because travel time as well, like, you know, you're looking, and then I don't mean to go back on the professional side, but like reimbursements, you look at travel time, overtime, all these extra costs that are non-reimbursable. So, you know, being able to do, just like you mentioned there, would help us support to be able to pay better if we could control those costs a little bit better within each organization.
Okay, well, if we could, and I'm happy to have offline conversations, and then obviously we have to be somewhat, you know, we have to be careful about how we implement these things, like as you said, because we certainly don't want the impression that we're cutting services or anything like that, which is clearly not the case. But you know, frequently those misinterpretations are pretty easy to have. So perhaps we could, you know, if some providers maybe could have a further conversation about that. So
I think the other part of that,
Katie, again.
I think the other part of that, Senator, was the minimum number of hours. Some of our providers set a minimum number of hours, like 4 hours for service, and that allows to cut down on the travel time. Whereas if you send somebody out for 2 hours and they go to 3 or 4 locations in a day, you accumulate travel time, overtime, those sorts of things. Some providers have chosen to set a number of hours a person needs to be with a client in order to perform that service, and it's helped with their efficiency, but they can't see as many people in one day. And sometimes a participant might not need someone for 4 hours. They only need 2 hours of help in the very early morning or at night. So it's kind of like micromanaging the provider to an extent. If we, you know, look to implement some type of legislation there, that a minimum needs to be met. So I don't know. That's just my humble opinion on it.
Yeah. Okay. Well, because I think we want to allow the flexibility for the most efficient way to do it, while at the same time making sure that folks are getting the services. And it sounded to me like there were some things that perhaps our mandates might have been not helping, but let's talk about that too, because that's the other kind of thing on the, you know, because we want to try to make it. I mean, yeah, we need to get people into jobs, we need to retain them, we need to pay them and whatever, but we also need to, you know, if there's other ways to help do that, we definitely want to do that too. And again, you know, some of these may seem like smaller proposals that are just sort of administrative, but if they can be helpful, we should definitely be looking at those. So, and Katie, again, I'm talking too much, but talk about the.
Really good stuff, Senator Bernini. And I did see, Wendell, you had your hand up. So I'm assuming you were looking to contribute to the discussion around supporting those unpaid family caregivers.
Exactly. And thank you, Vernon, for bringing that up, because I think we spent quite a bit of time this morning talking about the professional side. And I know that the word respite, when I was a personal caregiver, I didn't have that opportunity. I think that's a wonderful thing that could be worked in. But the other major part that I'm certainly a proponent of is of training, or having availability of training for individuals. When, like I've said many times passionately, that, when you hear the word cancer, and then you become the caregiver, what resources might be out there to help me or help the family caregiver better prepare, better educate, to be educated on what they can do at home, rather than possibly even relying on professional services. I have to say, other than a couple visiting nurses in the early stages, I didn't have anyone else to come in. And again, this is not being sympathetic to myself, but I'm thinking all the time of what can we do better, and that's part of this committee that we're assigned. And I agree with Vernon 100%. Is that I think it's a very important component here, because there are more and more, and at least here in Sussex County, our aging population is just overwhelming. And I think there will be people with resources to cover their own in-care or in-home care, but there will be many that cannot. So I just think that training or anything that we can do to provide help to the caregiver. And I did present to you the AARP Caregivers Handbook, and that tool. And I think, Brian, to your point a while back, was you have a list of items that that communicate the different divisions where people can go get help, an 800 number. But honestly, I've never seen that, and I've been living in Sussex County for 25 years. And that doesn't mean I missed it or threw it in the trash, but as we do sometimes. But I think this is something that we have to find a mechanism to make sure that people understand when that letter comes to you, or that it needs to be read, or the opportunities to help others. So I'll shut up because I'm on my bandwagon, but I just believe so much in this and haven't been through it. So thank you.
Thank you, Wendell. Yeah, I mean, I wholeheartedly agree too. I think education is power. And, when I think about our population with dementia, that's some unique skill set is needed in terms of providing care to someone with dementia. And, that skill set changes as the person progresses through the stages of the disease. But education is key and its power, and it can really provide that support that families need in order to care for their loved one as they progress through the disease. And that may, as you mentioned, Wendell, help address some of the workforce issues as well, as families are more prepared, capable, trained in providing that care to their loved one. And it really comes back to training and education. And I'm curious, Brian, so I mentioned, I know DSAPID has been doing some things to enhance and innovate around the way the state is supporting our caregivers. I know you mentioned this position, which is really exciting, that'll be focused on dementia and caregiving. But is there anything that this group could do to promote what you have or support what you have going on at DSAPID in support of caregivers, that we could put recommendations forward that it would strengthen some of those activities that are already happening?
I am all ears. When Wendell was speaking, I said I was about to interrupt and say, please give me any insight that you have, because I got on my soapbox the other day with my director, and I actually used Sussex County, because in every meeting I'm in, we talk about sharing the availability of what sources we have out there. And I said, okay, I can hire somebody with ARPA funding to pick up the telephone and call every person in Sussex County. I can go door to door in Sussex. What exactly is it that we can do to make sure that every person knows who we are with our ADRC, with our number, with our website? What else is it that we can do? I am open and ready and invite all ideas on any other way to communicate with anybody who may not know about the services that are available. Even Wendell, when I think he was mentioning like the transition out of the hospital, you kind of get that letter. We work with the facilities and we tell them who we are, and they have the materials. So again, open to any ideas that this group has or anybody else. Please.
Brian.
Yes.
This is Nancy. One of the things that we had thought about before, and I was never able to get any traction, was maybe working with the pharmacies and the pharmacists to, when they're giving medication that obviously is a cancer medication, a dementia medication, a Parkinson's medication, something like that, that you put caregiver information with that as part of the, maybe just put it in the bag so that they're getting that information. So whether it's about the ADRC or the caregiver resource centers or, DCARD or whatever. But I'm wondering if working with the pharmacists could be a way to get the information out.
I think so. I want to work with somebody on that action, ask them, make sure there's no type of HIPAA violation in that. And there's not. I hate when that comes into it because it seems to stop us more than I feel that it needs to. But we'll work through that with the Human Subjects Review Board and get through that. But it's a great idea to work with the pharmacies. Thank you.
Yeah, it is a great idea. So Brian, where, and Wendell, first of all, dead on, right? How do folks currently get, for lack of a better word, trained? So, if something happens and all of a sudden you're in a caregiver situation, I mean, obviously you're working with the healthcare providers for your loved one, whoever that is, but where, I mean, if I call the 800 number and say, hey, I've got this, a situation now, and I'm going to be providing care for someone with X, Y, Z. What happens then? I mean, the Alzheimer's Association with Katie is fantastic. My assumption is you reach out to the Alzheimer's Association, they have resources, they can help you get plugged in. And is that sort of a, organization by organization situation, or is there, I mean, how do people get trained, I guess, is and I apologize that if I don't have a good answer to this in my head already.
Senator, good morning, it's Wendell.
Hey, and Wendell with his Long Island accent.
But let me address something, Brian. Brian, the other thing, to Nancy's point a minute ago, is we've had discussions here around our town and the villages that we have down here. There was discussions of also using the realtors, especially with preparing when a realtor sells a home, they give you a packet of information generally, or through a homeowners association. So those are other venues where you might be able to reach out and capture some audience. But I think if I could just address the training, I can remember being at Johns Hopkins and going in a step-by-step procedure on what I had to do as far as with my friend to how to take care of the medical situation. And then at BB, I can remember, and I'll just share this openly, I may have already said it, but I've actually been invited to speak to the student nurses on March 19th to discuss an ilio conduit and how that affects your life. But because when my friend was in the hospital, I got the call at 2 a.m. to come over and change the appliance. So, and I'm happy about that. But I have to say that I give a lot of credit to the home health nurses when they did come to my house. And then they said, do you have, for falls and so forth, the potential for all these things. Luckily, there was a first floor bedroom. But a lot of that training came, and again, credit is credit where it's due. And that is through the nurses, through the home health nurses that provided that service. So I believe that, if we, and again, I just think it's, and again, back when we first met, but it's like the driver training sessions, where you could have an actual live session, whether it's via Zoom or whether it's live, and you have a workbook, just like you would in education, and you have a plan, and then you lay this plan out and you train people and talk to people on a one-on-one situation. So, and to Brian's point, you really can't go to everybody's house, but if you could do it somehow or another collectively and through, I'm just a big proponent, and you said it, Katie, training is what it all boils down to. How we provide that, I don't really have the answer, but I'd certainly, it's a dynamite way, I think, to really help through the encouragement process too, because it's difficult on the caregiver when you're not experienced. We all probably been there, and you're not experienced at doing this, and all of a sudden your life changes. And so how can we minimize that life-changing experience to make it okay?
Wendell, this is Jackie again. And although I'm a provider, I also was a personal caregiver with people with Alzheimer's and some other issues. So, I mean, I feel your story and I can kind of relate to that. And, I don't know how to catch people before they may go in a hospital, but I know from my times on discharge for the SAPIT, I never heard about them on discharge. Like would be very handy for for the discharge nurses to be able to provide that. But even after you get discharged, typically this is more Medicare, but you'll get a nurse maybe come to the house or an aide 2 or 3 times for maybe 2 weeks, maybe 4 weeks, depending on what your discharge plan requires. But at that time, hospice, they train you in the home how to give, morphine and a number of different things. So why can't home health care? Now, I know with the Board of Nursing, there's a lot of, chatter and getting, kind of your boundaries of whether the liability is going to fall on a nurse, if they're going to train you, or an aide. But I think that's something we could look at, because there's a number of people that are discharged that don't have funding to get, to do it themselves, have not gotten into Medicaid, have not gotten into the SAPIT, and they're on a mountain by themselves, and their own health is declining. So if there was some way we could even get the home health force to help people when they go home to start the primary education, I think would alleviate a lot of stress.
And also,
and what is, I'm sorry, go ahead.
No, I was just going to say that that I think sometimes people they need that little push somehow or another, so that we know that I can go. If I had the directory, fortunately, I want to say that I was fortunately capable of taking care of my friend. But maybe on the other hand, what if it were my mother? And that changes a little bit. How does, taking care of a female versus, so all these things interplay. And it's just, but I agree with you that, Jackie, that if we could, through home health nurses and Brian, I totally agree. I hate the word HIPAA. I've lived around it so much because, sometimes you just have to talk, and you're not trying to mess with anybody's life. You're just trying to do the right thing. So.
Yeah,
I'm sorry.
okay. Well, and no. First of all, this is exactly right. And I guess the point is, what is the best point of contact to get people the information they need? And I'm happy if folks want to set up meetings. I'm happy to do that. I can reach out to the hospital association. Obviously, right now is not a good time. They're literally scraping the barrel, asking anybody to come in and help out. But once we get through this pandemic, we could have a discussion with those folks about, hey, every patient who's going out, make sure to get that, be getting the appropriate.
Are you heading home?
Yeah, getting it.
Okay, let's go.
I'm sorry. And I think the other thing that I think we sort of do on the legislative side is sort of pick up, raise the profile. I mean, it can be little things, but sometimes little things. Let's have a home care. Home care awareness week, right? Training awareness week or something, and those kind of things. I mean, I'm always, even after 28 years in the legislature, I'm always pleasantly surprised at how sometimes those things can really generate, real interest. So happy to do that kind of stuff as well. But that's good stuff. I mean, I think that's good stuff because it's and Brian, please correct me if I'm wrong, but it sounds like there's actually a fair amount of resources out there for folks. We just gotta get them plugged in. Is that a fair?
I mean, I would agree with that wholeheartedly, Senator. This is Katie. Definitely, there's some really great resources out there, and we hear time and time again, people are unaware of them. They don't know where to go. They don't know how to access these resources. And then the other issue is just navigating through the resources. I mean, those are the things that we hear time and time again from the communities that we serve at the Alzheimer's Association.
Yeah, and that's the kind of stuff that folks in my business, we're pretty good at that stuff, right? Right? Politics is what you do for a living, right? It's trying to get attention to the right things or not, So let's talk about how we could leverage yours truly and my colleagues and others to help with that, because I think that might be a good way to do that. And I'm willing to do it. I mean, Berna, if you say, Colin, you got to be on the radio, 2 hours a week for the next 6 weeks talking about home care training, I'll do it, right? I mean, and we just, Go ahead. I'm sorry.
No, it's Verna. I was going to say, and I know my colleague Nancy Bernali wants to pipe in here because she lives this every day in our community outreach program. And I will tell you, what you said, Katie, is absolutely correct. It breaks my heart sometimes when I hear stories and I think, oh my gosh, we could have helped them, but they didn't know about what we can offer, what we offer here at Easter Seals. And, it's the same way with, I know Nancy throws things your way, Katie, because, you have things that can meet certain needs that you might hear. So, I think there is a lot of out there, but we do have to find a more comprehensive way to keep the messaging out there. Because the other piece of this that I wanted to just quickly say is you can be going along in life and have you don't need to know this information, right? Right, Wendell? I mean, like you're saying. And so, you're to be forgiven if you threw away some information somewhere along the way because you didn't need it at that time. But you just never know when you're going to need it. The reality is it can't be just a one and done. It's got to be an ongoing looking at all the different resources, whether it's the pharmacists or the discharging or what, it's got to be built into kind of the system. And realizing that every day you may come across someone who suddenly desperately needs this information. So Nancy, I'll let you pipe up.
That's okay. I was just gonna respond to some of the training because one of the other things that we've talked about and I've heard caregivers say, but also it's in some of the surveys that have been done recently, is the continued training, particularly related to medical things that people have to do at home. And so, I had a thought about maybe working with the PT, OT, speech, nursing programs that we have available and be able to have I haven't flushed it all out and maybe there's funding to do it, but to go to a library or go to Easter Seals or someplace and every Friday families could go and just ask a question, just say, I heard something about a pureed diet, but I'm not really sure what that means. Or, talk to the student speech pathologist and say, how do I do a pureed diet? Or, I hear gurgling, what does that mean? Or how do I help my dad transfer to the toilet? They sort of showed me, but there's so much going on around discharge. And because home health isn't involved for a long time, like you said, Jackie, they might be there for a week or two, but after that, the caregiver is kind of on their own unless there's some major medical change. And so being able to have access to people that they can ask those questions to without having to go to the emergency room, it's not the hospital, it's not something necessarily their primary doc can answer, but being able to say, okay, I can actually talk to a PT or a speech pathologist or whatever, and maybe get my questions answered. So just to...
Thanks, Nancy.
Excellent.
Senator Wendell, again, I think you hit the nail on the head. It kind of excites me to think that maybe the state of Delaware could do 1 week a year set aside for family caregivers, whatever, get it a nice fancy name. But I think with advertising in conjunction with what Brian has and all the other information we have, we could call it Awareness Week. But I think something like that could be, I just think that's a terrific idea. And, I was just sitting there thinking, you remember, and throughout all the police departments, it's have a cup of coffee with a cop. Well, it's in this area, we could have a cup of coffee with Brian, maybe, or any of you in your specific. Brian, wouldn't you like to have 10,000 phone calls every Friday? But it's a good idea. It really is a good idea. I think that but is that something that this group could possibly work toward? Maybe not in this segment, but another segment down the road. But I just think, again, it ties into education. And, we've had National Fire Prevention Week for as long as I've been old or aged, and change your smoke detector batteries in, October and whatever, when the daylight time changes. So these are things that would ignite possibly people to get interested and maybe not be afraid to ask those questions, as Nancy said. So anyhow.
No, and that's, no, Wendell, I think it's really good because, and again, as Verna said, the key is consistency, right? But I think this group can say, let's start that process, right? And I mean, the nice thing about Delaware is if you can get all the folks together, which you can in Delaware, we can start building that and creating its consistency. And I think the state can certainly play a role in that. And because we're not talking incredibly expensive process. This is an awareness thing, and there are ways to do it. But I think that should be one of perhaps our stated sort of 2 or 3 things is, hey, let's talk about getting awareness of services available to folks. It's obviously going to be multi-pronged, but discussions with the hospital association, the pharmacists, the primary care folks, whoever we think is necessary to help in that end, but also just sort of a general public knowledge thing could be helpful. And I actually think that should be one of the things that we come across and say, look, we're going to push for this and whatever that looks like. But thank you anyway. I'm sorry again, Katie, talking too much. Just tell me to shut up.
This is Nancy. Can I just jump in real quick? Because
please.
May actually is Older Americans Month, so you could sort of jump on with that. And November is National Family Caregiver Month. And so you could jump on, we could do something around that. And then Katie, I don't know what is dementia, is there a month or just
June is Alzheimer's and Brain Awareness Month.
So, even just jumping on to those things that are already out there and just expanding what we do from a state standpoint could be helpful.
Yeah, great. So you folks are all going to be hosting statewide Zoom calls with me, just FYI. I'm going to throw that out there.
Absolutely.
Nancy's
be
great
prepared.
at that.
Yeah, well, I'm sure you're all great at that. My point is to use my network to send out the invites. Then I'm going to sit there and listen. But okay, well, great stuff. And I do think that's a critical piece. And I will tell you that just again, as a layperson who's learned so much. And by the way, thank you all, everybody. This has been, regardless of what comes of it, incredibly great for me just to learn so much, and I'm incredibly thankful. But I will tell you, when I started this process, I was like, oh gosh, this is an untenable problem. There's just not the resources, whatever. And I understand that's still the case in a lot of ways, but it's nice to hear that our problem, that at least some of the problem is, no, we have good folks who are doing these things. We have to, the problem of connecting them with the people who need them is less of a problem than having to create the solutions. And doesn't mean those other problems aren't there, but that seems to me to be a less of a hill to climb. So I think that's sort of the good news, at least from my perspective.
Yeah, I would agree, Senator. This is Katie. And I think, right, it's all about leveraging the strength of the community partners that are out there already statewide. Like I think at Easter Seals, you all do so much in support of caregivers. And Senator, you had asked about training. I mean, Easter Seals offers training for caregivers. The Alzheimer's Association, we have training around the basics of the disease and caring for a loved one with the disease. And then, of course, I know DSAPID, you offer your training programs for caregivers as well. So there's a lot of really great things happening out there statewide. It's just it's a matter of connecting people to those resources. And then, Brian, something else I was thinking about as we think about connecting people to resources, I do think it'd be helpful to have a centralized place where people could go and then get connected out to those resources, but also a way that we could track as people, just the success or effectiveness of a campaign. If we were to run a campaign to get the word out there, but to track the effectiveness and success of that. And so I think about the ADRC. Is that something that the ADRC would have capability of? Is there something that we could propose that, if you need to increase resource or funding to the ADRC, that we could propose within our recommendations so that the ADRC could be that, again, one-stop shop, but then connect out to resources like Easter Seals or the Alzheimer's Association or whomever that's already out there in the community offering these resources and support for caregivers.
Yeah, if they're going to be the intake for one of these events, then yeah, there's a way that we could definitely track how many calls they're getting and what sources they're providing. Absolutely. But the more and more we talk about this, the more I'm thinking about this new position for the dementia caregiver person and how they're going to be able to help with this. They would be instrumental in that as well. So yeah, we can get it done.
Great. And very nice. You have your hand up.
Before I forget, I wanted to ask a question about, well, two things actually. One is, and Brian, I don't know if you can find out any information on this, but there is actually a line item in the governor's budget for the Office of Management and Budget. There's a line item in the budget in their budget that says it's for health services contingency funding. And it's an $800,000 line item for respite, but I haven't been able to find out like what that exactly is. So if you have any way of finding out, I don't know if that's something that ultimately comes back to DSAPID, but it was an additional $800,000 for something, and I haven't figured out what it's for yet, but it says respite. So I was glad to see that. But the other thing, and I think, Wendell, you brought this up before, and I wanted to see what the group felt about in terms of whether this would be important to include. The idea of a caregiver registry. And I think you talked, Wendell, about when you've been through the experience, you may be willing to help others. And I just wondered if that is something that we think has potential. I don't know, Brian, I don't know if there's some regulatory issues with that, and Nancy, I know we've talked a little bit about it, but I'm just curious. I wondered if that was something, again, it gets back to that problem of even if you can identify and have a little bit of money to pay somebody, but you don't have a caregiver, is there a place that, could we somehow have a statewide registry or database to track that kind of thing?
Vernon, if I could just touch base there, it's funny you would bring that up because I was thinking as Brian was speaking and Katie, and I'll use AARP as an example. We're a volunteer organization, and that's part of my life. But I wonder, I was just thinking off the top of my head, to your point, would it be possible if there, and I guess the same thing you're saying, but to have, like for Sussex County, you've got Mary and John and Bill and Joan, they're your advocates, volunteer advocates that maybe could field some, that people might feel a little more comfortable with calling a volunteer because they're not state employees and they're not this, that, or the other. I mean, I don't think anyone has any problem with calling Easter seals at all, but I'm talking maybe there's a little bit of phobia. They don't want to call the state and get tangled up in the phone webs and all that stuff. I just wonder if that's just a thought on my side, that you could have maybe a group of folks in Newcastle County, Kent County, and Sussex County as caregiver advocates, or I don't know what, just thinking off the top of my head. I don't know what your thought is, Vernon, on that.
Wendell, I need you on our Respite Coalition. I need to get because we don't have representation from AARP on it, and it would be great. But again, that's one of the things that we're looking at from the Respite Coalition is, can we do some volunteer training? And particularly my thought has been within like the villages and another group that's within another group, so that you're talking to friends in your neighborhood that might be able to provide the support that you need, but really giving them some training first, and then looking at, is there a database that we can do? How do we support that, from a funding standpoint, and make sure that we're doing background checks and things, but really working within those groups of communities that even working within a business, that like there might be a group of friends at Bank of America that you could train, and they would be willing to help their coworkers. So really looking at groups of volunteers that way too.
True. Yep. Be glad to help.
So Katie, if you can share his email address with me, that would be great.
Oh yeah, absolutely.
Maybe I don't want to help. No, I'm just kidding.
I won't give you a lot of work. It's
hey, no stealing, Wendell. No stealing, Wendell. We get first dibs. First dibs on Wendell.
Another good point you just made, Nancy, is that I volunteered BB too, and we just got a call this past week from a little church group of ladies who, in their spare time, they get together and they make quilts. And they wanted to know if they could donate their quilts to BB's auxiliary so that we could sell them in the thrift shop with the money going to BB. So you're right. Those offspring little groups, they don't want to come to BB. They just want to make the goods and give them to BB to the auxiliary to sell. So there are those groups of people that you probably, like a group of employees that are dedicated at any big company or any small company. They do highway cleanups. Why wouldn't they want to help their neighbor? You know, so that's a great idea. Well, I'm like Senator Bernini now. I'm talking too much. I apologize. I'm on a roll.
Yes, no, Wendell, you do not talk too much. I definitely talk too much. You do not. So.
Oh Lord.
So okay, so we have sort of two. Please, summary just in my mind to help with is one is obviously the money, and we got to get some sort of specifics on what that looks like and what the recommendations would be and what the action, what our action should be on that. And then the second one is figuring out and there's been some great ideas, but figuring out what specifically we're going to try to recommend and try to pursue to create awareness of folks to be able to connect them with the services. Is that a fair summary on
Yes,
those
sir.
2 points?
Yeah.
Okay. And go ahead, Katie. I just wanted to summarize that so I have those right in my mind.
No, I was going to say I absolutely agree. Those are the two things that I had noted as well in terms of takeaways from this conversation.
Yes, and I've learned through this process, consult Katie's great notes, because that's when things get on Katie's notes. She is so fantastic. And then and I apologize. I'm having a little brain cramp here. There was at least one other sort of relatively major thing we had talked about, and I'm having a little brain cramp of what that specifically that is. And it may have been an offshoot of these two things, but if the group wants to pitch in, or if most of what we talked about was focusing on these two issues, but
was it career pathing?
Yeah, that's probably right. The non-financial support for folks, right? The way to help.
Yeah. This is Bob Byrd. Can anybody hear me?
Oh, hey.
Yes, sir.
Hey, Bob.
Yeah,
Thanks
I apologize. I've
so
been
much.
driving all over the place. I have been listening in on remote. On the money thing, I would suggest because the Delaware Association of Home and Community Care has a major initiative on this issue that is ongoing. They're meeting with the state, the Joint Finance Committee, I believe sometime around the 20th. I don't have my notes in front of me, with a proposal on wage increases. And Katie, if you wanted to touch base with Jean Mullen, she can fill you in. We've done DOC has done a tremendous amount of work on this issue. They've got testimonials lined up, and they do represent almost 60 providers statewide that provide home care. So I think that's a good place to start, because a lot of what we've been talking about is being initiated and brought forward while we're discussing it. In terms of issues like the training, we've been talking about this for years, quite frankly, and we haven't made tons of progress. I got to be frank about it. And one of the things that I think was very apparent to me in looking through the summary. Sorry, I've got two dogs that are now crying in the background. The summary of the research that we did back about 5 or 6 years ago. And by the way, Lisa Bond ran that work group. But there was all of these issues were really front and center, and it was a large group. I have to be honest with you. I've looked through the notes, and so much of that work has not happened. Nothing has happened to the recommendations, many of those recommendations. So there seems to be an open playing field here for things that can still get done, because not much has happened. I'll have some written remarks once I can look at the transcript. But those are some top lines that I wanted to get in front of the group.
Hey, Bob, that's helpful. If we could get that stuff you know, the reports and the outlines and everything, that would be tremendously helpful.
Yeah, we can get, I can put you in touch with Rob Lattin, who's the doc PR director. And he also works with Bayada, so Wendell probably knows Rob.
Yeah, okay, that'd be great. Just, you know, because like you said, if we've already framed the issues, you know, and
yeah, it's just an enormous amount of work and time has been, and actually there's been some research. I just don't have it in front of me. I used to be president of DOC, and I've been off that role for the last year, so I'm not as I don't have that stuff in front of me. But I'm well aware that there's a significant corpus of work that has been done and is ongoing on these same issues. And one of the challenges we have is we're so siloed that people are really doing redundant jobs, saying the same things, but there's no coordination between the various resources. I'm talking human resources, people that get things done. There's a lack of the ability to put these things together and reach a critical mass where we can really make things happen. So I think that there would be an opportunity for collaboration. And again, I would suggest that that Katie give Jean Mullen a call and just tell her I suggested that you give her a buzz.
Yeah,
And,
absolutely.
She's really on top of all this stuff. So anyway.
Great, thank you. And
No,
she serves on the larger Aging in Place working group as well. But I agree, so there's definitely a need for alignment and consistency, and I think it would be really helpful for me to talk with her.
Well, there's some money available, you know, and we've heard this a lot, but I mean, there is a crying need for increased pay, and a lot of these issues you guys hit on. Scheduling is a nightmare. Yeah, you want to do a lot of these individual things, but if you have a couple of hundred different cases and everybody wants a different time and you're trying to schedule all of these things, it is, if you're doing it manually and you do not have the kind of software tools that are really necessary for, you know, getting through the mountain of alternatives that are available, then you're going to get lost. Yeah. There's some real practical issues underlying the ability to implement some of these things that I think that a lot of us have been dealing with, and a lot of progress is being made. And there are a number of initiatives, particularly in the software area, by some significant vendors on dealing with exactly these issues. But we should be at least aware of, you know, what's coming down the pike. My own view is that the whole issue of caregivers and support for caregivers is going to completely be changed in the next 5 or 6 years, probably with the kind of impact that Amazon had to small retailers. I mean, it is going to be huge, and it's going to be technology based, and the wagon's going to be pulling out here in a year or two, and I think it's going to make a lot of what we're doing impossible to implement, and other things that we haven't even thought of are going to be on our plate to deal with. So I just toss that out because I happen to be aware of some of these initiatives, and they really have the ability to impact this whole area in a very significant way.
And I see Shirley with your hand raised.
I may have scared everybody. I apologize.
Well, no, thanks, but I'm sure it's absolutely true, and the fact that folks have already put in lots of time and effort in trying to sort of work toward the same goals we have, that's fantastic. So maybe, you know, we can, and, you know, maybe we can take what they've done and they can take what we do and push forward to, put it all together. So.
Yeah, Colin, they have been in touch with a number of legislators, and I'm not part of that the PR group. I know who they are, and I signed them. This is years ago, but they've been working with a number of people down in your backyard to try to move this forward to the Joint Finance Committee. So I'll see if I can hook you in with Rob Lattin, so at least you're aware of some of these initiatives.
Yeah, no, that'd be great, because perhaps we can piggyback on that and make some real progress.
Right.
Yeah, no, that's good. That's good stuff. Thanks. Thank you, Bob. And then, Bob, I did have one follow-up question. You talked about the scheduling nightmare and everything. When that first came up, and you brought that up a few weeks ago, I left with sort of the impression of, the state's part of is part of the, we have regs that might be making it difficult to help solve those. Was that a fair takeaway, or is it more complex than that, or is that just not really where the issue is?
Bob, it looks like you're muted.
Oh, I'm sorry. I apologize. So on the scheduling and all those things, the software's coming, that's going to helpful, and I get it. But are there regs or things that we do at the state that we could do to help with that, to make that easier, or do we have unintentionally putting up obstacles to help resolving that? And that's sort of the impression I got when we first brought it up. But if I'm, if that was wrong.
Colin, that is an excellent comment. There are things that we could be doing. The regulatory environment is a maze of piggybacked and minute little changes that basically drive providers nuts. Some of them are necessary in my view, and some of them not so much, but they're there. And a lot of this stuff has also been legislated and approved. So it's really very difficult to make much progress. And quite frankly, the oversight by the state for these issues is, there seem to be, and this is an editorial comment, some proprietary issues about ownership and wanting to make sure that people follow the rules without necessarily providing perspective.
Yeah, no, it's a common thing. Well, Bob, if you think, and again, we're back to sort of the provider side, but if you think there's, sort of the glaring things that we can fix, that's also, I think, something we would love to hear. And again, obviously not going to be able to fix everything, but it's hey, these two particular regs are, particularly aggravating for X, Y, and Z. Maybe we can weigh in and try to, at least make progress on those.
We would be delighted to have your support, and I will talk to the people at DOC who have a whole litany of issues related to this, and we would love to get you involved.
Well, and I think this group, if we can sort of, we're putting out sort of the priorities, and I think that, with the exception of me, this is a pretty powerful, a very knowledgeable, powerful group who's, very well informed, and I'm certainly hoping that when we sort of put the imprint of this working group on things, that it's going to carry some more weight. And I think, by the way, I think that is true. When we do that, and that's why if we could identify 2 or 3 of those things, I get a chance to weigh in,
right?
And maybe we'll accomplish something despite me, because sometimes when I weigh in, people go the other way. But that would be great. Well, Bob, thank you. Tremendously helpful feedback, and the fact that a lot of this stuff is already on some other folks' tables too. That's great. We could access that tag team, and that's I think really news.
Well, we will.
And by the way, I just have one fun. Yeah, please do.
And Colin, you're way too modest.
Well, but I have a funny line here, so I had to call in. My internet went down, and the number you dial for Zoom comes up on my phone as the Seventh-day Adventist Church. so we're all at church today. Who knew?
That's good.
Katie, what else should we be doing here?
Yeah, so I see Cheryl. And by the way, you have your hand up, and I know we're past 11:30.
Oh, I'm sorry.
Cheryl, I guess we could try. I don't know if we have any public members, but let's get to Cheryl first.
Thanks. And I apologize.
I'm sorry.
We're trying really hard to get on earlier, but for whatever reason, my technology wasn't working. Maybe my phone didn't want to believe I was going to church. I'm not sure.
Yeah, it's contagious. It's contagious.
On Wednesday, it was like, you're not going to church today. But it wouldn't let me on. So when I drove as fast as I could for my other appointment to get to the office, and it let me on when I got there. So I wanted to echo some of what Bob said and say that, we work closely with our friends in home care and in the hospital system, because I'm in the long-term care area, but home care, group homes, other settings, we're all in the same boat when it comes to our workforce issues. We don't have the pool of people that we need, whether they're family caregivers, whether they're professional caregivers, whether they're, CNAs, whether they're nurses, you name it, we're all in the same boat. And we all have individual proposals for funding. And those are absolutely, the right of every group to go and try to ask for. But to the degree that we can all be speaking some of the same words when it comes to, hey, we need to do something about increasing the pipeline and training and all those things that you guys have mentioned. I was listening a lot earlier than you saw me face to face. I think to the degree that we can all be talking and using the same words, ditto, cheers, anything we can do to be able to help. We're happy to participate in that and share that, because you're right on the same page as our association is. And, people go back and forth from home to facilities, or hopefully out of facilities to home. And I came into this role of having been a home caregiver for my mom for 4 years. I've been there, done that. I know what this is like. And it's, there's a lot of work that needs to be done. We have a big issue right now with staffing agencies in our world. Some are great, and some have been taking advantage of the staffing shortage for huge price gouging. There's some that are also doing the same thing on the family side. So there's some education that what families should be looking for, what kind of licensing approval, background checks, all those kinds of things that they should be looking for when they're looking for care. There's some great ones out there, and there's some that are, probably not so great. So, and things I would have wanted to know if my mom was still alive. Yesterday would have been her 100th birthday if she was still with us. So thank you for everything. And this has been a great meeting, even though I didn't get to see you face to face until just the last few minutes. So, and anything.
Well, Cheryl, first of all, we're incredibly flattered and thankful that you broke the speed limit to participate.
Without a ticket. Yeah. Mm-hmm.
Oh no! Did you really? I'm so sorry.
No. Without one.
Without a ticket. Okay, good. Yeah, that's well, thank you. That's tremendous. Well, and the fact that I'm really excited that the association is working on this stuff and that we can piggyback and add. That's great. Right? Yes, that's really exciting.
I think we're all speaking off the same. Using your church analogy, I think we're all speaking off the same song sheet. So.
Yeah, we're on the same hymnal. Absolutely right. So, although I'm Catholic, we don't sing enough. I'm just saying. And also, if Rebecca, if you're on the call, could we find out when that JSC hearing is so I can be there?
I think it's the 24th.
Okay.
I think it might be the 24th, but we can check. That was Verna.
Okay. Yeah. All right, Verna, we're having lunch that day and going to JFC. Just saying. So,
can I?
And Katie, I apologize.
Yeah, they start the 22nd. DHSS starts the 22nd, and then they go through the 24th.
Thank you.
Go ahead, Verna.
I kind of wanted to bring it back to, I know we're over time, and the 2 or 3 things we want to take forward, and obviously the workforce is one we talked about, and then also the creating an awareness campaign that's important. But I don't want to lose focus, and I'm wondering if the third thing, as we talked about, is that that caregiver support area. So we really having 3 things to take forward, and under that caregiver support is where you get things like the training, that mechanisms to support training for caregivers, and maybe it's a registry, maybe that's part of, maybe creating a registry is part of that, and then just respite support, which probably means funding. That probably comes back to dollars too. Because there really just isn't a whole lot of resources out there to fund respite. I mean, I know DSAPIT is I don't know if we lost Brian, but they fund some, but just having some dollars to fund respite is also part of it. So that's kind of where I was coming from in terms of 3 suggestions. Does that make sense?
No, I think they're excellent. And real quick, and I apologize, I know we're over time, but on the respite side, are there models out there in addition to just straight up funding, getting the cash to help? Are there models out there to create incentives for employers or tax credits for folks who let their folks off to do? I mean, and I don't want to get into the family leave debate because that's I think a much larger debate. But I mean, family leave was specifically for caregivers. I vote for it. But is there we're going to do it, and that's an unfair question. Tell me, but are there other sort of creative ways of helping on the respite side in addition to just the cash?
You mean like the tax credits we talked about?
Yeah, whatever that is, or incentives for employers, or and is anybody else sort of trying to increase the access to respite with in addition to just helping pay for it?
Well, I mean, it's not, it doesn't speak to like employer incentives, but again, the Respite Coalition, we are looking at what other states are doing relative to respite and seeing what we could potentially replicate in Delaware, whether it's using volunteers or paid or whatever it might be. So we are looking, that's part of what the coalition is doing. And I have some meetings set up.
That's exactly my question. That was exactly fantastic. They're looking at it. Fantastic.
Good. You're welcome to join our Respite Coalition too, if you want to, Senator Bernini.
I don't know if you want me, but I'd be happy to help. I will bring down the average of that committee down significantly, but I'm happy to do it. So,
I think
anyway. Hey,
I'm sorry. If I could just add one thing, Bern, I think that's perfect what you just said, because I think we've come to a point here, and as Mr. Byrd said too, we don't want to rehash and keep rehashing. I think Senator and Katie, I think these are 3 in whatever order, but these are 3 good targets because I think, and again, I'll go back to Mr. Byrd real quick, but first time I listened to him, he said that he's been listening to the same old thing over and over for years and years. And that's what we don't want to do. We want to take action, do our job, and then it falls on the legislature then to either accept or reject our plan. So I just endorse that, Verna, tremendously, and Katie and Senator, all of you.
And Katie, I would just couch that in like unpaid family caregiver, or call it family caregiver. So it's distinguished from the professional caregiver, because sometimes people just lump caregiver into one thing. We want to make sure that those unpaid family caregivers are they're the ones that are sort of out there struggling.
Yeah, absolutely. It's a good point, Nancy.
We want to help them. Yep. Great. Well, guys, thank you so much. And Katie, please, I'm interrupting you. Do we need to do any formal things? And I didn't get on till late. Did we do the minutes and all that kind of stuff?
We did. So I think the only thing left, and I'm not sure if we have any public members, so I'll look to Will for that, is opening it up for public comment if we do.
We do not have any members, but just to make sure we cover all the formalities, if you would like to make public comment, please raise your hand using the raised hand function on Zoom. No hands have raised. And if anybody would like to submit written public comments, be added to the public record, please send them by email to william.lescas@delaware.gov. That's william.lescas@delaware.gov. Thank you.
Will, thank you. And Will, thanks so much as always for everything.
pleasure.
Great. Well, I think this was an awesome conversation today, and I took a lot of extensive notes here. So I know our next Aging in Place working group is the 25th. So certainly we'll provide an update to the larger group on, kind of the direction that we're looking to take with our 3 recommendations, it sounds like. And then I'll put my head together with Senator Bernini. We'll, see if we can kind of synthesize it a bit down, what we discussed today, into more specifics. And then, as a group, we can really hone in on the specifics of the recommendations that we want to put forth to the larger group around these 3 areas that we discussed today.
Yeah, absolutely. And I apologize. I know we're getting late. And Katie, thanks again. But just one last time, and is everybody comfortable with those 3 core issues? Because I think that's what we're going to sort of pitch to the major group, and then really, like she said, sort of boil down. If anybody says, "Oh, we're missing something," or "I don't think that's that important," please, chirp up now. And I think we have a great group, and everybody can be, as respects each other. We can all talk back and forth. So if anybody has, we're going to go with those 3 unless someone has some strong feelings otherwise. And if, speak now or forever hold your peace, but not really. But speak now or, let us know.
Yeah, it makes sense. I just would like a day or so to just sort of, process some of this and make sure that I'm 100% beside the 3.
Yeah, absolutely, Bob. And I just wanted to make sure that we're not. I probably didn't phrase that correctly. I just want to make sure we're not missing a big piece that we had talked about prior or something.
I think so. I think it's good.
Yeah, I'm excited. I mean, I think we could boil this down. And again, we may not be making, an earthquake, but even if if we get it down to the things that are just achievable and push the right way, we can really make some progress. I'm pretty excited about it.
And if you're interested, Colin, I can send you the information that I have on that reimbursement rate.
Please, yeah, that'd be great. And the other thing is, folks, if anybody's interested, I'm happy to sit down with the Controller General staff where we can get pretty much any budget question answered. So I'd be happy to do that. Our staff down there is just fantastic. So, and I'm happy to do that.
All right.
And Bob, I hope we're not, dancing like state government frequently dances and dances and dances. I was talking to somebody we've been dancing 25 years on some education issues, but hopefully we're going to, we're going to get sink our teeth into something and make some progress. Let's hope anyway.
Sounds good to me. I've been down this road a number of times. That's
I'm with you. We dance and dance, but I think we got a pretty good core, and I think the credentials of this group, and once yours truly gets his teeth into something. So hopefully, and I know I have some colleagues who feel the same way. So let's push.
Great.
So thank you, everybody. This is really, really, really great. And Katie, thank you so much for everything. And I apologize I was on late.
Oh gosh, no worries. I'm glad I was able to. It worked out, and you were able to call in and be with us.
Yeah. Let's all be honest. Katie's running the show, and I just chip in. Let's be clear.
Team effort.
So, which is how it should be, by the way.
Katie, just real quickly, will we get what is that thing called where we'll send out something for our next meeting so that we can schedule that? Our next
the doodle poll.
Yeah.
Yes, that'll be on its way.
Thank you.
If not today, then probably by the end of the week.
Yeah. Thank you.
Great. Well, thank you, everybody, so much.
Great. Sounds good.
This is an awesome group. It's really a privilege to work with all of you on this.
Yeah.
Great.
Yes, and I'm going to hang up on the Seventh-day Adventist Church. I hope that's not a problem.
Everybody take care.
Thank you, everyone.
Recording.
Thank you.